Why X-rays are important in root canal treatment. X-rays play a crucial role in a root canal treatment by providing a clear and detailed image of your teeth, roots, and surrounding bone structure. They help your dentist assess the extent of the infection, locate any damage or cracks in the tooth, and evaluate the health of the bone around the tooth. Without X-rays, it would be much harder for the dentist to determine the best course of action for your treatment. How X-rays help diagnose root canal infections. During the initial visit, your dentist will take an X-ray to diagnose the root canal infection. The X-ray helps identify the size, location of the infection, such as whether it's limited to the pulp or it's spread to the surrounding bone. This allows the dentist to determine if a root canal is necessary or if there is more severe damage that requires additional treatments. X-rays can also detect abscesses, sites, and other complications related to infection. Planning the treatment with X-rays. Once the infection has been diagnosed, X-rays help your dentist plan the root canal procedure. They allow the dentist to see the exact shape of the root canals and how many canals are involved. This is especially important for determining the right tools and techniques for cleaning and shaping the canals. X-rays also provide an accurate of the tooth structure, helping the dentist avoid any damage to the surrounding tissues during the procedure. The X-rays during the root canal procedure. Throughout the root canal procedure, additional X-rays may be taken to ensure the dentist has thoroughly cleaned and shaped the root canals. X-rays allow the dentist to verify that all the infected tissues have been removed and that the canals are properly prepared or sealed. This real-time feedback is essential for the success of the treatment and ensures that the infection is completely eradicated. X-rays after the procedure. After the root canal treatment, a final X-ray is typically taken to confirm the canals have been successfully sealed and the tooth is properly restored. This X-ray provides an essential record of the completed procedure and helps the dentist ensure that there is no lingering signs of infection. This also allows for the future references if any further dental work is needed. As you can see, X-rays play an essential role throughout the root canal treatment process, helping with diagnosis, treatment, planning, monitoring the process, and ensuring the procedure's success. If you're considering a root canal or any concerns about the procedure, don't hesitate to reach out to us at Lema Dental Clinic. If you have found this video helpful, please like, subscribe, and leave any questions or comments down below. Thanks for watching, and we will look forward to hearing from you soon.